Dear students, welcome back. In the previous session, we have discussed about changes in electrical reactions. Now, in this session, we are going to discuss about physiological basis for electrodiagnosis. The physiological basis of electrodiagnosis is the mechanism underlying normal electrical activity of a muscle and nerve when stimulated by electrical impulses. Okay, now, so what are the physiological bases? Here we are going to consider the stimulation of nerve fiber, stimulation of muscle fiber, and refractory period, accommodation, action potential, and also the reactions of degeneration. Under reactions of degeneration, we have three types: partial reaction of degeneration, complete reaction of degeneration, and absolute reaction of degeneration. If you see this stimulation of nerve fiber, muscle fiber, refractory period, accommodation, action potential, all these are the properties of a nerve fiber and also the muscle fibers, isn't it? Yes. So stimulation of nerve fiber, first we will see. So in the resting state, a neuron is charged, cell not conducting a nerve impulse. In the resting state, a neuron is a charged cell not conducting a nerve impulse. The difference of electrical potential is minus 70 millivolts between the tissue fluid outside and intracellular fluid inside the neuron, which maintains the dynamic equilibrium of the resting neuron and underlies the generation and propagation of the nerve impulse. If a brief minimal duration impulse between 0.2 to 1 millisecond is sent to the nerve, it will be sufficiently long to stimulate the nerve, cause depolarization. Okay, and which is followed by contraction of the muscle. So nervous tissue demonstrate the phenomenon of accommodation by which the threshold of the stimulus increases. So if the threshold is going to increase, this nervous tissue demonstrate the phenomenon of accommodation. Okay, if the rate of stimulus is slow, as in triangular or sawtooth pulses, it will fail to overtake the increasing threshold and excitation does not take place. Therefore, no muscle contraction is produced. Okay, that means the minimal duration impulse is still less than 1 millisecond, then only the nerve is going to excite. Okay, so next, stimulation of the muscle fiber. Next one is the stimulation of the muscle fiber. Like nerve fiber, muscle is bounded by the cell membrane, which has a potential difference of minus 90 millivolts. It has a highly specialized neuromuscular junction where the nerve enters the muscle. It is possible to excite muscle directly and produce depolarization of the muscle membrane, causing excitation of the muscle using pulses of varying duration. Okay, so muscle has a much smaller accommodation property and thus will respond better to slow rising long duration pulses also. This is particularly seen in denervated muscle, where a good response is obtained from a slow rising triangular impulses with long duration, and it is difficult to obtain contraction with short rectangular pulses if the muscle is denervated. Okay, so the electrical properties of both nerve and muscle must be considered in electrodiagnosis. Okay, electrical excitability is characterized by three factors. One is the intensity of the current, another one is the duration of the current flow, and next one is the speed at which peak intensity is reached. So this one. So the speed at which peak intensity is reached. In cases of partial and complete denervation, electrical excitability is altered specifically. Okay. Now we'll see the next property, that is the refractory period. So it is the time in which the tissue excited by means of a stimulus does not respond to the second stimulus. Okay, so this becomes the absolute refractory period. Here you can find, so this is the absolute refractory period you can find. So in this, it only excites for a single stimulus, and at the same time, if you can give during this period, if you give another stimulus, it will not respond to that stimulus. It will take the first stimulus to show the excitation. Okay, so what do you mean by refractory period? It is the time in which the tissue excited by means of a stimulus which does not respond to the second stimulus. Okay, in a denervated muscle, the refractory period is longer. Okay, now next we'll see the next property, that is accommodation. It is the property of the tissue to adapt itself to the slowly rising stimulation intensities. Okay, accommodation is the property of the tissue to adapt itself to the slowly rising stimulation intensities. Okay, if a muscle has denervated, it has lost most of its power of accommodation, and the long duration pulses that rise gradually. Okay, if your muscle has denervated, it has lost most of its power of accommodation, and the long duration pulses that rise gradually will be able to produce a brisk contraction. Okay, this is about the accommodation. Now the next one we can see is the action potential. An action potential is the basic unit of nerve communication and is achieved by rapid sequential depolarization and repolarization in response to a stimulus. It is the mean of propagation of an impulse along the course of a nerve. It is the ability of the nerve and muscle membrane to develop transient changes in potential which can be transmitted from one point to another. So this is about the action potential. Okay. Next, if you see the reactions of degeneration, so here normally this reactions of degeneration was first studied in 1868 by Earp, made his classical observation on the reaction of degeneration in muscles which are deprived of their nerve supply. Since then, much progress has been made in the use of this observation for diagnosis. It is same as denervation. The presence of reaction of degeneration means the muscle is denervated. The absence of reaction of degeneration means that the muscle is normally innervated. Okay, so the presence of reaction of degeneration means the muscle is denervated. The absence of reaction of degeneration means the muscle is normally innervated. The reaction of degeneration can be partial or complete. And also we can see the absolute reaction of degeneration. Okay. So if you see the partial reaction of degeneration, if trauma, disease or other factors have produced a partial lesion of a motor unit, there will be an obvious diminution in the contractile response when Faradic current is applied to such a muscle. This response is called partial reaction of degeneration. So what is the type of current used here? To check it, Faradic type. For the Faradic type of current, it shows diminution of the contractile response in the case of partial reaction. Okay, this response is called as partial reaction of degeneration. If partial reaction of degeneration is less apparent with progress of time, then the prognosis is good, and it is also called as partial denervation. Okay. If you see the complete reaction of degeneration, if the lesion totally obstructs the activity of the motor unit, there will be no response to the Faradic type of current. Okay. So in the complete reaction of degeneration, the motor unit will not respond to the Faradic type of current. Depending upon the extent of lesion, the muscle will respond to long duration rectangular pulses or slow rising sawtooth or triangular pulses. If the denervation is more profound, long duration pulses with a trapezoidal or sawtooth shape will be most effective. This is also termed as complete denervation. Okay. And if you see the absolute reaction of degeneration, when the denervation with marked degeneration has been present for over a year, muscle in such a case, muscle atrophy with replacement of muscle tissue with fibrous tissue takes place, and there will be no response to any electrical stimulus. This is termed as absolute reaction of degenerations. So these are all the physiological basis for electrodiagnosis. Okay, in the next session we are going to discuss about the methods of electrodiagnosis. So in that we are going to discuss about strength duration curves and nerve conduction test, nerve conduction velocity test, and also EMG. Okay, electromyography. Thank you.